And welcome. I'm Anita Chesney, a Create the Good ambassador. Also, I'm the Veterans Chair for Triad North Carolina AARP and a retired Lieutenant Colonel in the United States Army Reserves. Today, we have special guests Harry Robinson, Chief of Voluntary Services at the South Texas Veterans Healthcare System, and also Barbara Abbey, a volunteer at South Texas and winner of Create the Good's recent Show Your Love volunteer contest. Harry, briefly describe what South Texas Veterans Healthcare System provides to veterans and the community.
I'd love to share a little bit about our program here at South Texas Veteran Healthcare System. Here at South Texas, we're very fortunate that we have volunteers like Ms. Barbara and veteran service organizations and community volunteers who pick up the slack of things that's needed here in our facility. And we're very fortunate. We're in South Texas, San Antonio, and Military City, USA. South Texas Veteran Healthcare System has three areas that we focus our patient care from. Audie Murphy campus. Our hospital is named after Audie Murphy, who was the most highly decorated veteran in World War II. Our Kerrville campus, and then we have several community-based campuses throughout the city and area. I like to highlight and talk about our mental health program. We're one of the facilities that have a female-only mental health area. We have a dormitory, our geriatric area, or we call it our community living center. We have our spinal cord injury area, our polytrauma area, and we also have our polytrauma rehabilitation, which is an off-site facility. And we're fortunate to have a South Texas veteran Fisher House here in South Texas. We deal with about 100,000 unique veterans. We have over 1 million outpatient visits. We're very proud of our ambassador program. Our ambassador program is one of the programs that Ms. Barbara participated in. The ambassador program works that we have veterans who come here for appointments. Our parking lot's huge. And by the time an 80-year-old spouse pushes a 90-year-old veteran to the entrance, it could be some delays in times, causing them to arrive short of their appointment time or be late. So we developed a program where people like Ms. Barbara literally loaded veterans up or assisted veterans into wheelchairs, and then they push them to their appointments within the hospital or within the clinic. When this happens, we found out that the veterans, number one, compliment and appreciate the service, but more importantly, it impacts patient care because our hospital noticed that we had less late start appointments or we had less missed appointments by our veterans. So that was one of the benefits from this program. The other thing that we have that I'd like to highlight here at our facility, or a program we have at our facility, would be our No Veteran Dies Alone program, which our chief chaplain started, basically having an age of presidents that turned into the program we call No Veteran Dies Alone. Pretty much World War II veterans are passing at alarming rates. There's veterans who are by themselves in the hospital. They have no loved ones in the area, no family members, no friends in the area, and they find themselves in a life by themselves. This program allows a volunteer who signs up on a roster. They report to duty. They cover a period of time when a veteran's at the end of life, and they sit at the bedside. Sometimes they talk with veterans, sometimes they interact, but basically they let the veteran know there's someone in the room with them. This program has had a lot of success because when loved ones or family members find out that a veteran expired and he was not by himself, it brings joy to their heart. Of course, all of us can kind of see what's going on now with COVID and the folks buying by themselves and the impact it has and trauma it has on them. Having a program like this has made a major impact, and we're glad to be able to offer those services to our veterans. Another program during this time of year I'd like to share is our Adoptive Veteran Program. During the holidays, we have a program where social workers identify veterans who are in need. Those veterans are put on a list, and then our employees here at South Texas identify those veterans, and they follow the wish list that the veterans provide and purchase or buy those items for those veterans. Now, our volunteers and community donors, veteran service organizations go out and purchase food items. We put together a food basket to help deal with food insecurities during this time of the year. During normal years, unlike this year, we've had a big Christmas party. We have Mr. and Mrs. Santa here. Our Mr. and Mr. Santas are volunteers who have been with us for well over 5 years. They come in, we have a party, we have music, we have food, and then the veterans receive their gifts, and our volunteers help transport all those gifts to the veterans' cars or the social work cars who help get the gifts home for the veterans. You know, some of those families have 5 folks in the family, so you can imagine the amount of gifts that go with a veteran. And our employees go all out. We've had employees purchase beds, living room furniture. You can imagine the items that go along with doing that and getting that to our veterans. And we're very proud of that program. The other thing I wanted to kind of highlight and share with you is that we're very fortunate. We have a large youth volunteer program. We have several schools who are involved here at our facility. And Ms. Barbara in our office, she's an office volunteer in the Voluntary Service office. She helped us with processing and onboarding those processes. Those are a few of the programs that we have that I'd like to highlight for you.
Wow, Harry, thank you so much for telling us all about your services. I wonder if you could just tell us a little bit more about how many volunteers you have and how important they are to the success of your programs.
Our volunteers are into 2 groups. We have our regular scheduled volunteers and our occasional scheduled volunteers. The bulk of those volunteers are occasional scheduled volunteers. You know, we do about 3 major events here at our facility. One of them is our motorcycle rally. We did that for years. We also have done car shows. Every year we do a car show in Kerrville and in Audi. We've had as many as 190 to 200 cars participate in our car shows. We have a lot of volunteers here helping sell food or do events and activities. We're bringing the veterans from our community living center out the parking lot, see the cars and push them through the cars and look at cars as we have the judging going on. And then we also have a golf tournament we do every year. Our golf tournament, we have a lot of volunteers who participate and help in that. Our community and our veteran service organizations all participate and help making that a special event. A couple of the programs I like to highlight is we have our shuttle program where our drivers drive shuttles to bring patients or their families in from the parking lot. We have a large parking lot to help get them to the front door. We have our Red Coat Ambassador program, which I mentioned Ms. Barbara was a part of. You know, it's important because the feedback we got from our veterans once we started this program, they tell us that they really love having someone greet them at the door and meet them. And Red Coat Ambassador, Ms. Barbara served in that capacity, meets veterans at the door of the facility, welcomes to the VA, thanks them for their service, and then offers to escort them or wayfind them to their appointment or their clinic or their appointment and interacts with them along the way. We've had a lot of positive feedback, and it's improved the customer service with that particular program. You know, here at our facility, it's over 45 years old. A lot of renovations and changes have been made. A lot of the corridors and hallways, you have to go to 2 or 3 of them, or maybe up and down a flight of stairs or some elevators to get to different areas of the hospital. So we're having this Red Coat Ambassador wayfinding program has improved the customer service for our veterans. I also want to highlight, if I could, that we have Ms. Barbara, who participated and assisted with here in our office, screening and helping to onboard volunteers. She helps them find their way to get their ID cards, helps them make their way to occupational health to get their health screenings that are required. One of the things that I find that's very interesting and it's helped a lot here at our facility is volunteers really make an impact by assisting their families of veterans who are here and guiding them and helping them get where they do. Our information desk is very well received. We have volunteers constantly asking, how do I become a volunteer at South Texas? And I want to work at the front desk and things of that nature. So we're very fortunate. One of the issues that we've been dealing with is as COVID has happened, a lot of our community volunteers or organizations have offered to do hero meals, and they deliver meals here to a hospital for our nursing units. For the COVID area where we have nurses, physicians, providers, and clerks there working those areas, and they donate meals to feed those. And transporting those meals and coordinating and getting them through the hospital has been one of the tasks that our volunteers do, and Ms. Barbara has helped with that tremendously. And it's helped improve our customer service. So those are a few of the things that are unique about our program and how ways Mrs. Barbara and other volunteers help.
Well, thank you, Harry. That's just incredible. I can really see that volunteers have a huge, huge impact on your healthcare system. And we really appreciate your being here today and sharing those wonderful stories with us. Barbara, I read that you live in New York. So please tell us how you decided to volunteer with the South Texas Veterans Healthcare System.
Yeah, I live in Western New York, south of Buffalo, or in sometimes in the Finger Lakes region. But my daughter got hired down here by South Texas in the urology department as a PA. And so I said, "Oh, you're going to warm weather. I'm coming down and spending time with you in the winter." And I said, I would love to volunteer at the VA. And once I got started, I wanted to give back to the veterans. I never served or anything, but I thought this was my way of giving back. And so I came down, I started serving and volunteering, and it was so much fun, and it was such a happy family and everything that I just did more and more and more. So now I'm up to like 5 days a week. I do 9 or 10 hours a day, and I just love it because the staff, the veterans, and everything are so much fun. It's just one big happy family here.
Wow, Barbara, that's incredible. Well, it sounds like you really do enjoy what you do. Could you just share with us a couple of heartwarming stories about your interactions with veterans?
Well, I just love the veterans. In the morning, I get to greet our volunteers. So most of them are veterans. Some of them are World War II veterans and Vietnam veterans that we have. We still have World War II veterans that are volunteering for us. And I greet them, and then I will get talking to them, and they will give me little tidbits of information of where they were and what their service was like. And then I go home and I research it all. Then I come back and we have little chit chats about everything. And they feel just like their dads and grandpas to me and grandmas to me, and it just ends up so heartwarming that you just end up loving it so much. I worry, like right now with COVID happening, I don't get to see them. They're not here as often, so I don't get to see them. So I miss seeing their smiling faces and the communication and camaraderie we had. The other thing is at lunchtime before COVID, one of the things we did was you could go down to the cafeteria and eat lunch, and a veteran might sit down with you, and you would say, "What branch did they serve in?" And then they would go on about how they served, what they did, and it just heartwarmed you. You just wish you could record everything they said and listen, and you just learn so much history just by sitting here. One of the big events that we have is called the National Salute, in which it happens around Valentine's Day, and we invite dignitaries in. The dignitaries come in and get to talk to our inpatients. At that point in time, I got to take around what that's called the military ambassadors. They're young members of a group that are active military, and when they go into a room to see a veteran, it's usually of a different generation. So you get to see at least two generations interacting. Sometimes it's three generations apart that they could have been the same age as like the military ambassadors' grandparents or something. And to see the interaction between them, and the veterans that are in the hospital are just so happy. And it just brings a smile to most of their faces. They all want their picture taken with them, and it's so much fun.
Thank you, Barbara. Those were indeed great stories of your work. And I can tell you love your work, and I'll call you a super volunteer. And we just really appreciate your being here today and just hearing all about the wonderful work that you do and about the South Texas Voluntary Services. If you know a veteran that continues to serve by giving back in his or her community, or a volunteer who is supporting veterans in the community, please nominate them to the Honoring Heroes contest. All you have to do is submit an essay, no more than 500 words, with a photo describing the exceptional service of the veteran or volunteer. The person you nominate is entered for a chance to receive the grand prize of $1,000 from AARP Create the Good and a matching $1,000 donation from Cabot Creamery to the nonprofit or Veterans Affairs Medical Center of the winner's choice. The contest is a great way to thank a vet or someone who volunteers with veterans by nominating them. The contest closes on December 31st, 2020, so don't delay. Thank you, viewers, and thanks to all of you who submit nominations to the Honoring Heroes contest. Take care and be safe.
Thank you, everyone.